We're talking about the Dade Kutupon Municipal Assembly LADMA. It says it is liaising with other health facilities to provide residents with accessible health service in the municipality. That assurance comes on the back of the closure of the La General Hospital for 2 years for maintenance work after it was declared unfit for purpose. The project, which is estimated at $52 million, will see to the reconstruction of the emergency, surgical and maternity blocks, male and female wards, laboratories, diagnostics center and accommodation for staff. MC Solomon Kote Nikwe has been speaking to JoyNews.
Being the leader of the assembly, we went to the ministries. We had a meeting with them, and they made us to understand that they are strengthening the hospitals and the clinics around our municipality. That is Osu, Teshin, and other places, so that our people can be going there for healthcare. But we also said, no, we can't close the hospital down entirely. So they said if we can make an arrangement for them, I mean, so far as accommodation is concerned, they can leave escalating staff so that they will operate something like a clinic over there. So we've spoken to Laman Samokwe. They have a block that they are going to use it for clinic, private clinic, but now they've agreed to give the place to us. So we believe by the close of this week, we'll be able to finish on that aspect, and we'll go back to the ministries, and then they will start posting their people to that place. So they'll be having that skeleton staff or clinic in Lada de Kutupon.
So this clinic you're talking about, where is it located, and which cases will be reported there, or all kinds of cases?
I'm not a professional when it comes to medicine, but they told us they'll be leaving some few doctors and few nurses who will be taking care of cases that will be coming to the clinic. But you see, one aspect that also came up is that if you are closing down entirely, then it means your records room will be closed down. So even if someone has to go to a nearby clinic or hospital, then the person is going there to start anew. But if we have something small here functioning, the person can go there for maybe his or her records, and then maybe go to any other hospital that is nearby. So we'll be having doctors and nurses there. So as to cases that will be referred or cases that will be treated there, I can't specifically say. That is not my field. But what I know is we'll be having doctors and nurses in Lada de Kutupon to take care of a few medical cases that comes up.
As the MC there, speaking to my colleague Michelle Thompson, who joins me in the studio to tell us what she saw when she went to the hospital today. Mamiesi, you're welcome to the show.
Thank you, Kitty.
Let me also quickly announce that we do have on standby the PRO for the Ministry of Health, Elom Ametepe. Elom, thank you for your time as well. We'll come to Elom subsequently. So, Mamiesi, what did you see when you went to the hospital today?
So, the hospital was in very deplorable state. You could see deep cracks in the walls. Most of their air conditioning were rusted, and then the wires were out of their sockets. So, and some of the air conditioners were leaking as well. We weren't able to go into some of the wards because they've been shut down currently.
Okay.
And then the health workers were moving around equipment and other documents for the facility to be closed down. So we didn't have that opportunity to go into the various wards and even some of the departments. Okay. But from outside and some of and parts of the OPD, you realize that the state in which the hospital was actually needs to be reconstructed.
Okay, which is why they're doing this. I'll talk to Elom briefly, but did you get to speak to any of the health professionals, or did you get the sense what they feel, how they feel about this?
Yes, when I was there, you realized that it was a form of relief for them that the hospital would undergo this transformation, because it wasn't, from what I hear, it's not fit for healthcare delivery. And so for them to be able to, for the hospital to undergo this transformation will be great for them and also for the community.
Yes,
However, we weren't able to get them on record because at the time we got there, they were working. And also we need to have clearance from the Director General before we could go ahead with such interviews.
Okay, I'll come back to you, Mami. But let me speak to Elom Ametefe, who is PRO for the Health Ministry, joining us. Hello, Elom. Thank you so much for your time this afternoon.
You're welcome.
So let's start with the plan. We've had the MCE speak about arrangements being made here and there. Is there a comprehensive plan that we're following regarding the fact that there are patients, there are health workers? Do tell us what the plan is.
Yeah, so there are plans to transfer the patients on admission and then any other equipment or anything that we have at the facility. Actually, this thing has started way back. If you wouldn't mind, I could give you a little background to.
Okay, if you make that brief for me, I'll appreciate it.
Yeah. So the ministry received a request from the management of the hospital that there are big cracks or huge cracks, as Isi has rightly said, in the building. So we did structural integrity, and we realized that it's not good for occupation. So the process started, and the assessment took place around 2017. So based on this request, we also decided to move in and then have these things done properly.
Okay.
We also realized that the facility as it is, it will not be in the interest of us to rehabilitate it. We just have to pull it down and put up a new structure altogether. So that's the background.
Okay.
And then, as you said, yes, there are plans. There are plans for the patients to move. Some of them will be going to Ridge Hospital. Some of them will be going to Lekma and any other facility that management didn't pick. Then, concerning the staff of the hospital, they will be transferred to other health facilities around.
Okay. Well, so it looks like as if that has not been done because you keep saying will be. Shouldn't that have happened already by now?
Yeah. So as I said, the ministry gave the Ghana Health Service or the facility up to 15th of March to move.
Okay.
So it is now in the hands of management to organize this evacuation or this movement for us to have access to the site to start work immediately. So that is what we are doing. So as of now, the management of the facility is working with us to evacuate the place.
All right. $52 million. Do we have that money sitting down already?
Yeah, so as I said, it's a loan. So it's a cabinet as I speak with you for approval. Once the approval goes through, it's estimated that it will take about 16 weeks to complete the other processes so that we'll start the construction. Which
means that we don't know when the cabinet will approve this loan, correct?
No, it's not as if we don't know. We are sure, cabinet. That's why the letter went, the communication went to the facility to evacuate. So it is something that is just around the corner.
Okay. Alam, is there anything else that our viewers, people who may be affected by this, need to know?
They've given you a little specification about or the project scope. If I don't know whether the previous speaker talked about the project scope, but it's supposed to have an outpatient department, that's OPD, a well-equipped emergency unit, and public health department, surgical block with 4 theaters, inpatient, that is wards for male and female, laboratories, pharmacy, diagnostic units, physiotherapy department, etc. So these are some of the facilities that we are expecting there.
Well, finally, I said that should have been my final question, but just this coming in is that some of the workers have raised concerns. They say they've been given 3 months to go home, 3 months salary to go home. What's going to happen in this case?
Well, I'm not privy to this information, but I'll have to find out. I'll have to find out. As I said, I'm at the ministry, and that is the facility is managed by the Ghana Health Service. So I will have to find out.
But then you talk about an existence of a plan. So it means that there is a plan to do the evacuation of both patients and workers. So what do you have at the ministry level in terms of the plan to work, the plan for workers?
Yeah, so they may be talking about the casual workers, But as I said, I'm not in their management meeting, so I can't go further. But what I can say is that we have a plan. We work with the Ghana Health Service to ensure that there's this industrial harmony and all those things. So I'll have to find out I also have to find out from the management the decision taken so far. The last time I went there was a week ago when they were still working there.
One would have thought that at this time there would have been a comprehensive plan that the ministry, the management, and everybody else, all stakeholders are very aware of. But it's okay. We can get more of that information when we come to you.
As a ministry and as a service, as the Ghana Health Service, I'm sure there will be issues here and there, but these issues can easily be resolved. Once they have concerns, they should just channel it to the management of the hospital or talk to communicate to the Director General, Dr. Patrick Abuaji, and these things will be resolved. The regional director is also there. So these are not issues that are beyond the reach of the service.
Elom, thank you very much for your time. We'll come to you as and when there's more information on this.
It's a pleasure.
Elom Amethofe speaks for the Health Ministry. Mamisi, let's wrap up with you. When you went there, the plans, have already kicked in. They were moving the equipment out. Yes. Were they moving patients out as well?
I didn't see them move patients.
Okay.
Majority of the things I saw was equipment.
Okay.
Yeah, but the concerns that have been raised is the impact of the closure on residents or clients who've been patronizing the hospital.
What do they tell you?
It serves the LAC community, Nungwa, Teshi, and even some parts of Accra. So though the MCA has indicated that there are plans put in place for private clinics or even hospitals to take care of the backlog, we're here to see whether that is really going to, minimize the impact that it's going to make in the community.
Mamisi, thank you. Mamisi Michelle Thompson there, who went to the La General Hospital as they make plans to move out the equipment, move out the patients, in fact, move out the workers so that the building can be pulled down and rebuilt. We're still looking forward to more information on this. As and when it's available, you're sure to have it here on JoyNews.